So now we want to look at some exercises for strengthening the neck and the upper body, which will help with your headaches and your neck pain. The first one I'm going to show you is a progression of the chin tuck exercise, which you've been doing regularly now. So we really need to get some strength through these deep neck flexors and the outer neck muscles. So with the retraction exercise that you've been doing, that's been strengthening the inner muscles and also helping to mobilize the neck. What we need to look at now is just getting some global strength around the front of the neck. Now this is a problem in people with headaches because they sit like this and these muscles are a long-term stretch. They become long, they become weak. So a nice exercise to do this, it's not easy, but you can start small and build up into it. So we're going to lie on our back. And what you can do in this position is you can work on, it's like a little nodding movement. So imagine you've got a skewer going through your ears and it's just like you're nodding your head. So that's a nice way to start this exercise. So level 1, if you like, and you can nod and hold and relax, nod and hold and relax. And once you feel you've really mastered this movement, and it's getting pretty easy, you can move on to strengthening the global neck muscles as well. So with that, we're going to nod and hold, and then we're going to lift the head, but literally less than a centimetre. So we're thinking just a couple of mils, so your hair will still be touching the floor. You're just taking the weight of your head. So I'll just show you again. So you're going to do your little nodding movement, your little chin tuck movement. Hold there, and then you're just lifting, taking the weight of your head off the mat. You're not letting your chin stick out, so that chin is staying tucked in that nod position, and then you're just taking the weight of the head. So as you can see, it's almost a negligible movement, but it's really, really hard, and you want to work up. So to start off with, you'll probably hold for 2-5 seconds and do a few repetitions, and you want to keep building on that until you can hold 10 lots of 10 seconds. This is an advanced exercise, so you really need to make sure that it's not stirring your headaches up. If it is, just go back to doing your chin tucks, chin retractions, which you'll continue to do anyway. Remember, that's the number 1 exercise for headaches and migraines. The next one I'd like to show you is just a shoulder shrug with weights. So what we're going to do is just try to build up a little bit of strength. So we're very focused on stretching and massaging out these muscles. But remember, a tight muscle is often a weak muscle. So to get those muscles to relax and have good flexibility and mobility, we need to make them stronger. So you can grab some light dumbbells or a couple of cans of beans or something out of the cupboard, and you do this normally in standing. So again, you want to start in a really nice posture, and it's just little shrugs. I don't want you to shrug all the way up to your ears like this. I just want you to do like a third or a quarter of a shrug. Hold and relax. So literally just tiny little movements. You can start with no hold just to see how you go with it, and then you can build in 5 to 10 second holds. So you can do whatever feels kind of right for you. But the really important point with that one is not to take them up too far. Otherwise, you're just going to stir up these muscles and tighten them up again. Next, we're going to look at some exercises for the shoulders. So again, I've been going on about these rounded shoulders. We want to get those muscles around the back of the shoulder nice and strong, and those scapular muscles, shoulder blade muscles strong to help you hold yourself in that beautiful posture that we need. So for this, you need an elastic band. So I've got one over here. If you're buying an elastic band, a red one would probably be, they're graded, so yellow is normally easy, then red, then green and blue. But I tend to start with an easier rather than harder. So normally starting with a red. So there's 2 exercises I want to show you here. The first one is an external rotation. So I'll just show you nice and close. Imagine I've got an elastic band here. You're holding your arms at 90 degrees. Elbows are tucked into the body, and you're just turning those arms out and really slowly coming back in. So I'll just show you what that looks like with the elastic from the side. So elbows are tucked in, postures, lovely shoulder blades down and back. You're turning those arms out and very, very slowly tucked in. So you can hold that elastic band in between your hands like this. So out and in. Really important that you're not taking the arms down like this, that you're maintaining them at that 90 degrees. And you'll only go out as far as you can without pain. The next exercise that we want to look at is a rowing or a pinching of the shoulder blades. So again, you'd do this with elastic. This time you'd hook the elastic around the leg of a table or a pole or something nice and sturdy that's not going to fall off. So with this one, you're going to start with your arms out straight, and we're going to go out and pinching those shoulder blades back and slowly coming together. So from the front, it'll look like this. So the elastic's at the front, you can go out and back in. So what we're really trying to do is get that pinching between the shoulder blades. So there's two options here really. You can do this one, which I call the T, or you can do like a rowing kind of movement with the elastic. The really important things to watch here is that you're not hunching your shoulders up, that those shoulders are staying down, no matter which one you're doing, and you're getting that pinch between the shoulder blades. So a couple of options there, but really important to get those scapular, those shoulder blade muscles working, pinching those shoulder blades together to stop this forward hunched over posture. Okay, now we're going to look at just some general Pilates type exercises just to get some core strength through the middle. So the first one is probably one of the most common exercises we give people to strengthen up their deep abdominal muscles so it can support their back. So we're going to start lying down on our back and we're going to take our legs up into tabletop position. So really important here that we don't have an arch under our back. So you want to be in a neutral spine or even slightly pushing that spine down onto the mat. We don't want to be forcing it down, just gently touching down. With our legs, we want them at 90-90, so 90 degrees with the hips and 90 degrees with the knees. Once we're in that position, we're going to do little leg lowering. So before we do the movement, it's really important to turn our deep abdominal muscles on. So drawing the pelvic floor up and in, bringing that belly button back towards the spine. So really turning on those deep abdominals. We do that with a breath in, then we breathe out, stretch one leg down, breathe in, breathe out, swapping legs. Now you only take your leg as low as you can control your spine. So if I get to here and I feel that I'm lifting through here, that's as far as I would go. So as soon as you feel like you're losing control here, bringing that leg back up. So you're probably wondering what that's got to do with the neck. But the thing is, if you've not got control through here, then everything that comes above it, it's like being on a wobbly base. So the more control you can have through your pelvis and through your abdominals, then the better off everything above it is. So that's just a really basic deep abdominal exercise, core exercise. It's really good for the back and it'll set you up everything from the back up. The next one is glutes. And again, it's really important to have that control through that whole pelvic area so that you've got a nice solid foundation for all the other muscles to work from. So the bridge is a pretty common exercise. So again, lying down on your back, knees, you can either have them hip width apart or together, arms down by the side, and we're simply squeezing the bottom and lifting it up and lowering it down. So again, it's always good to have your T-zone turned on before you do your movement. So breathe in, pelvic floor up and in, drawing the hip bones across together and in, breathe out, lifting the bottom up, breathe in and lowering. Once that gets really easy, you can take one leg into extension or out here, and then you can lift with one leg and lower. So with that, if you are on the one leg, really important to make sure that you're not getting that wobbling through the pelvis. So it's all about pelvic stability. A couple more exercises I want to show you to work on those mid-back muscles. So these ones are on the tummy. And there's a couple of options. So the first one I'm going to show you is just a lift. So if we lie down on our tummy, having our arms just tucked in by our side, again starting with that chin tuck. So we're tucking our chin in and we're just lifting and lowering, lifting and lowering. As we lift, we're really trying to get those arms up and pinching those shoulder blades together. If that's too hard, you can do this one with the arms down by the side. So a little bit easier. You can do it with the head staying down, so you can just lift the arms. So there's a couple of variations here. You can do it with the head down up here, just lifting the arms. Or you can add the whole upper body in. Now, the next exercise is a little bit harder, so we've got those arms stretched out in front, and we're going to lift, and then we're going to do little flutters. So it's like a little swimming movement. Again, you can do this exercise with your head down, make it a little bit easier. Really important to make sure that the chin stays tucked in, so you're looking straight down towards the mat and that you're not arching through your back. So there you have it. There's a few strengthening exercises that I often prescribe to my patients. Of course, everyone's unique, and what exercise is good for one person might not be good for the other. So it's always best to be advised by your physio as what is best for you. Everyone presents with different muscle imbalances. These are just some of the common exercises that I tend to prescribe people that I see.